This animation will demonstrate a rotator cuff repair on a right shoulder. In this particular repair, the anchors used first will be self-punching all soft suture anchors. Once the sutures from these anchors are passed through the torn rotator cuff tendon, the repair will be secured in a knotless fashion with hard body anchors. To get started, the surgeon will introduce the first anchor into the shoulder in the appropriate position. Because this anchor has a self-punching feature, a separate instrument, called a punch, does not have to be used ahead of time to prepare a socket for the anchor. This helps save time in the operating room. With the anchor in place, the surgeon will hammer the back of the inserter to the appropriate depth. The anchor inserter is then removed and the anchor is secured within the bone. This process in this animation is repeated 2 more times for the tear. The bone where the rotator cuff tendon normally attaches to is prepared to get bleeding, which will help the tendon heal after the repair. You'll notice each anchor has 2 sutures of the same color exiting the bone. These sutures are actually joined together into one tail to help the surgeon pass the sutures through the cuff tissue. The surgeon will grab the sutures from one anchor and use a device to pass these sutures. This step is repeated for the rest of the anchors. After the sutures are passed, the sutures are cut into 2 individual strands. One suture from each anchor is retrieved out of the shoulder joint to be loaded into the hard body anchor to be placed on the side of the shoulder. A hole is prepared to allow for the hard body anchor to be inserted. Then, the anchor with the 3 sutures loaded is brought into the shoulder and the sutures are tensioned to allow for a good repair of the rotator cuff. Once appropriate tension is applied, the anchor is brought into the prepared socket and secured into the bone. This step is repeated for the second anchor. And the repair is complete.